Primeiramente, muito bem-vindo a todos. É um prazer contar aqui com a participação de vocês nesse seminário. Para a gente é um seminário muito importante. Como eu já tive a oportunidade de ir aqui conversando um pouquinho com a Lisa, que é a nossa convidada de hoje, esse para a gente é um momento de aquecimento, né, para o nosso Congresso de Ciência de Implementação latino-americano, que deve estar acontecendo em setembro, no município de Campinas. Se vocês ainda não ficaram sabendo dessa novidade, aconselho vocês a procurarem, a gente vai colocar o link aqui na nossa legenda. É um congresso que tem sido desenvolvido em parceria com os programas de pós-graduação em enfermagem da Universidade de São Paulo e o programa de pós-graduação em saúde coletiva da Universidade Estadual de Campinas. Esse seminário, igualmente, é promovido por esses dois programas de pós-graduação. Então, nós consideramos como nosso grande aquecimento aí pré-congresso latino-americano de ciência de implementação aplicada aos sistemas públicos de saúde. Para aproveitar ao máximo a participação aqui da nossa convidada, a professora Lisa Pfadenhauer, que está direto com a gente aqui desde da Alemanha. Eu vou passar já a palavra para ela, onde ela vai poder introduzir o tópico, né, do nosso encontro, que é a avaliação de contextos complexos para a implementação de intervenções em saúde, especialmente no âmbito de saúde pública, e compartilhar com a gente o trabalho que ela vem desenvolvendo em relação a esse framework, que tem se mostrado um framework extremamente potente para o trabalho aqui no nosso contexto brasileiro, especialmente. E falo isso porque aproveito para compartilhar a notícia para vocês de que o material que vai ser apresentado hoje aqui é um material que já está sendo traduzido, adaptado para o nosso contexto brasileiro, e pelo nosso grupo, e muito em breve deve estar disponível para utilização. Então, sintetizando esse momento de muita alegria, muita importância para a gente aqui. Agradeço vocês por fazerem parte desse momento e vou passar a palavra agora para a professora Lisa, tá bem? So, Lisa, welcome officially to our seminar. Once again, it's so great to have you with us. I just told everyone that this is for us a warm-up for our conference in September, and also that we are very happy to announce that the framework that I've been discussing today, it's already being adapted for Brazilian context with our group. So very soon we'll have like this available in Portuguese, adapted to be used also here in the Brazilian context, and that will not be possible without your kindness in make this available to us, to arrange that possibility to our group. So thank you so much for that as well. And the floor is yours. Please, I will let you introduce yourself or our topic for today. And please just enlighten us with the most that you can in the time that we have, okay? Thank you.
I will, and thank you so much for your kind introduction, although I didn't understand very much. I heard my very difficult last name, which is Pfadenhauer. So actually the first advice I got from my PhD advisor many years ago was to marry someone called Müller, because it would make my life so much easier, right? So now I have to live with Pfadenhauer, but at least everybody kind of sees the name as like, oh, I've seen it before, I don't want to pronounce it. So thank you so much for having me. It's a pleasure to be here, and I'm very delighted to be connected to you, Carlos, for the translation of the CICI Framework to Portuguese. You made an outstanding effort there, and I'm very grateful for that. And I'm very much looking forward where the work will get us. Today, I would like to talk to you about a little bit of the history of the development of the CICI Framework. And with that, I briefly introduce myself. I'm a public health researcher, so my background is very much in public health. We work with very large-scale interventions. We look mostly at the effectiveness of interventions. I worked in mostly population health interventions, so macro-level measures that were implemented, and we had a lot of cases of applying those. And most of that work I did at the University of Munich, where I did my PhD. Then I went to the US for a couple of years to do my postdoc there at the Emory University in Atlanta, which was also a great time to test the CICI framework in other interventions, such as WASH interventions, or water sanitation hygiene interventions, as well as diabetes prevention programs, which kind of helped me to further develop my thinking about context and implementation of complex interventions. And why do I say that? Because in the beginning of my career, I've mostly worked on the question, what works? And I think that's a question that's familiar to all of you, because as public health researchers, we do work a lot in intervention effectiveness assessment. So what works better than other things? And actually, what we realized more and more more than 10 years ago, was that we're dealing a lot of times with complex interventions. And these interventions are considered complex due to a variety of reasons, such as having multiple components that are interacting with each other. These components are implemented in different sectors. So for example, we looked at the ambient air pollution zones in London or in Beijing or in Munich, and interventions were implemented on various levels. Then we also realized a lot of times that problems were not just really simple and static, but rather dynamic, and they had interdependent causes. And with that, we also realized that a lot of times the solutions are also dynamic and also have some kind of unintended consequences, even though you try to plan and do as good as you can, but still things happen that you did not or were not able to anticipate. We also more and more realized that interventions must adapt to local contexts, resources, and populations, or sometimes the other way around, where you actually try to adapt the context to certain interventions to make it better fit or better acquaint or accommodate an intervention. And we also realized that whenever we try to transfer the evidence generated within one context to the other, that sometimes we didn't reproduce the outcomes and effects that we did in the context in which it was evaluated in the first place. So all of that kind of led to our understanding of complexity in public health interventions. And I'm sure you're familiar with that, just for you to see where we came from. And actually, the primary source of complexity is residing within the system in which we implement interventions rather than in the intervention itself. So the questions changed from what works to what works for whom and in what circumstances, in what respects, and how. And if we look at the conceptualization of complex interventions, you can see that in many of those parts, such as the number and behavior of recipients to which the intervention is directed, the range and number of organizational levels targeted by the intervention, the degree of tailoring intended or flexibility permitted across sites or individuals in applying or implementing the intervention, the level of skill required by those delivering, but also by those receiving, as well as the degree to which the effects of an intervention are context dependent, all very much relate to context. So there was a lot about context. And actually, back then we were like, well, when we try to transfer from one context to other, what do we have to consider? And one of the fields we then dived into was implementation science, because implementation science was one of the few fields back then that actually helped us address context, because it was one of the few fields that even paid respect to context in the first place. And when we look into how implementation science conceptualizes contexts, we can see that there has been a shift in the way implementation science has looked at context. So I brought you a super old definition by Alison Kitson, who is one of the key persons in implementation science. And she described context in 1998 as the environment or setting in which people receive healthcare services, or the environment or setting in which the proposed change is to be implemented. It consists of culture, leadership, and evaluation. And then if we move on to Esterbrook's, there's also the synonym for context, environment and setting in which people receive healthcare services, or in the context of getting research evidence into practice, the environment or setting in which the proposed change is to be implemented. Yeah, it's a bit more concrete now, as you can see. And if we look, and this is one of my favorite definitions by Graham Moore, anything external to the intervention that may act as a barrier or facilitator to its implementation or its effect. Not so sure what to make of that, but it becomes less static, it becomes a bit more dynamic. And then lastly, and I think this is one of the better definitions for context and implementation science, that context is a multidimensional construct that encompasses micro, meso, and macro level determinants that are pre-existing, dynamic, and emergent throughout the implementation process. So if we look at that, we can say that all of these definitions more or less agree that context matters in implementation science. However, there's some divergence. So context as a synonym for environment or setting or something different. And also what we can see is that these definitions move from what context is more to what it does to the implementation of an intervention. And it also kind of acknowledges more the dynamic nature of implementation efforts. And the approach to context and implementation science changed a bit over the past years. So context is still considered a wicked problem, but it has received increasing attention over the past decades. One indicator is, for example, that I got a lot of invitations over the past 2 years to talk only about context and implementation science, which I found rather interesting. And I think that's an indicator that people are getting more interested in context. However, there are still very inconcise definition of context in implementation science. There are several TMFs, theories, models, and frameworks in implementation science that reflect on context to a varying degree. So we do have, for example, Paris, the TDF, CIFAR, and others. But the way they look at context differs very much. So some of these frameworks talk about determinants, about factors. You all are familiar with the classical barriers and facilitators approach, right? Some of them talk about a system of context, but it's done in a very divergent degree. And I just give you a few examples. One of the examples that you are probably most familiar with, and I brought you the old version, CIFAR 1.0. You are probably also familiar in how Laura Damschroeder and her colleagues conceptualized context as the inner and the outer setting, and all of that very much referring to the organizational context. So when we look at CIFAR, it mostly relates to interventions implemented in a hospital, for example, or in some kind of clinical setting where you do have an inner setting and you do have an outer setting. And if you look what she puts into the boxes of inner and outer setting, you can also see that a lot of this is from the organizational literature. There was an update of CIFAR 2.0. I had the pleasure to review it as a peer reviewer. In 2022 it was published, and it still has this binary concept of an inner and an outer setting, but she extended on the factors or the domains contained in both levels. If we then look at Paris, which is also quite commonly used in implementation science, it has a very different approach of looking at context. It says it's culture, leadership, and evaluation. So it's very different in its conceptual foundations. Then we have the EPIS framework, and I don't know why my boxes are moved. Sorry for that. It should be around outer and inner context, because also EPIS reflects on context, both on the inner and the outer level, if you want to put it that way. It also refers very much to clinical contexts, such as where you would have like organizational staffing processes or patients, or you would have inter-organizational environment and networks, right? So that's something that also relates very much to organizations, and sometimes that's not applicable in public health to us. So that was one of the things that we always kind of struggled with with EPIS. Then we also looked at, of course, behavior change theories, which are commonly used in implementation science. So we would have the health belief model, the social cognitive theory, theory of planned behavior, or the trans theoretical behavior as one of the older behavior change theories, where context is always somehow somewhere, but mostly not in a predominant place. And more recently, and one of the most commonly used frameworks is the TDF, the Theoretical Domains Framework by Susan Mickey, where you do have the environmental context and resources and the social influences included as one part or one influencing factor to behavior change. So you can see that behavior, that context is always somewhere, but it's always, I would say, a less dominant aspect in implementation science TMFs. It's always there, it's mostly there, it's not always there, but it's mostly there, but rather in a minor position. In implementation science, in the times when I started to work with it, which was in 2013, something like that, there was the trend of complexity sciences and system science entering the field. And I think that led to a lot of changes when it comes to the way we conceptualize context. So we did have system theory and complexity theory, and all of them kind of led to implementation science at least acknowledging that we are moving away from pure acknowledging of barriers and facilitators and determinants, rather to looking into aspects such as interconnectedness or emergence or non-linearity. And all of these kind of different ways of conceptualizing context and thinking differently about context led to changes in implementation science. And if you look, for example, at these other properties, this is something which we feel or we can see is much more reflected now in implementation science. So what happened is that we looked at implementation context rather in a constructivist, rather than in this purely positivist thinking, because positivist thinking and us in public health, where we borrow and use a lot of methods that have been developed in evidence-based medicine, this is what we kind of race with, right? This is the language that we in Germany, when we're training public health, a lot of the training is very much grounded in medicine, right? So we learn very much to think in positivist terms. We're learning a lot about RCTs, where we're trying to strip off context to reduce, to make it as reductionist as possible. And in implementation science, suddenly we start to see like, well, we have to look at this in a much more constructivist view rather than a positivist review. We do have to see that context is dynamic. So this is something we definitely learn from complexity science and system theory. We also increasingly conceptualize the process as non-linear, where we would have several feedback loops. We would go back and we would go back and things would change and would have to be adapted. We also changed the way we looked at interventions, because we looked at them more as events in a system. So we looked how did the intervention change the system, and how did the system change the intervention, right? And that led to a more holistic approach to the intervention, context, implementation, interplay. What also happened was that we paid more attention to emerging unintended consequences. So colleagues of mine in Munich led on the development, for example, of a framework that would guide the assessment of unintended consequences in public health interventions. And I would also say that it helped us to embrace a more organic view on the intervention context diet and its very fuzzy boundaries. What do I mean when I say fuzzy boundaries? So whatever project, whatever intervention I end up working with, it's always this discussion, is this the intervention or is this the implementation? And I can't give the answer. So I'm always like, well, a good question. Maybe is that an implementation strategy, or is this actually part of the intervention? And then we debate and debate and debate, and different stakeholders have very different opinions. Sometimes we arrive at conclusions, and sometimes we just accept it as what it is. It's something very fussy, and we can't put a box on it, and we can't put it in a box. Unfortunately, although we like boxes, right? And also what I would say happened is that there was much more, how do you say, this openness towards embracing fidelity, towards embracing adaptation over fidelity. So previously, and I said you in the beginning, this is kind of a historic how things evolved for us, and why we felt we needed to develop a new framework, that we felt things moved from fidelity, so how like to what degree were you able to replicate that intervention that you aim to replicate, right? To adaptation. So we kind of saw the beauty in making things fit the context in which they were intended to show an effect, versus to being very true to the intervention as it was originally designed in order to have the intended effect and in order to avoid negative unintended consequences. Yeah, and all of that kind of was integrated into the way we developed this new framework. So in summary, we felt that there was a lack of conceptual and terminological clarity of the concept of context. There was limited empirical research. Yeah, as I said, there was a prevailing positivist paradigm, and we felt that this did not do justice to the complexity within context. Often there was an impracticability of assessing contexts, both in the TMFs, in the methods, but also in the resources that were available to us as implementation scientists. Yeah, most TMFs looked into the micro level and meso level of context. And for us public health people, we were like, well, you know, there's something like the community that we should also look at. And how do we, for example, adapt CIFAR to the community? How do we adapt EPIS to the community, right? So we felt there was something missing that happened on the macro level, and which was highly relevant to the interventions we were looking at. I mentioned the ambient air pollution or low emission zones previously. There was international legislation and regulation on that, right? So how did that come into play when you put something like that into action, and then it is kind of implemented on an international level, on a national level, on a regional level, and then even on a very small local city level, right? So we felt there was something missing in terms of levels. Then also we felt that a lot of times the static conceptualization of context and the way we assess context one time during evaluations, right? You said, oh, this is the context. And it's like, well, this is changing all the time, right? So we need to kind of make sure that we're accounting for the dynamic nature of context. And also a lot of times the neglect of the interconnectedness of the components of a system, right? And of course, and you probably know that, frameworks are like toothbrushes. Everyone has one and no one wants to use anyone else's. So we also felt we need our own toothbrush to make it fit the purposes we had in mind, right? And having said that, I think it's becoming very, very difficult these days to publish on new implementation science TMFs. When we worked on the CICI framework, which I'm going to introduce to you in a second, I think we had a much easier time to publish on TMS. It's getting a bit harder, I would say. So what our objectives were back then is to develop a conceptual framework that facilitates the structured and comprehensive conceptualization, assessment, and also reporting of context and implementation of complex health interventions in a pragmatic way. And we wanted this framework to be applied not only in systematic reviews where we originally came from, but also in health technology assessment and primary research, both qualitative and quantitative. And this is how we then moved into developing the CICI framework, the Context and Implementation of Complex Interventions framework. I do a quick break here, and we don't have too much time, but are there any questions to this point? Because I know I'm talking very fast sometimes, especially when it's about context. So are there any questions at this point?
Well, me myself, I have a lot of thoughts already. I'm feeling so blessed till now with all that you said, and I made some very interesting points here. But I think that just to make most of our time, maybe people could write their questions in the chat. I am looking at it, and if something pops up that maybe be relevant for a question right now, I can just make a signal to you, okay?
That would be great. Thank you. Yeah, and also, yeah, that's a good idea. Let's do it like this. So I will go into how we develop the CICI framework, but I'm gonna jump over those slides rather quickly because I think they are less interesting than the rest of it, right? I just want to show you that we did embark on quite an extensive approach to developing the CICI framework, which entailed, we had scoping exercise. In the beginning, we came up with an initial framework. We then saw that we needed to go deeper into literature. So we conducted a pragmatic utility concept analysis to see what is context, what is implementation, what's the boundary to setting, what's the boundary to environment. And then we went through several applications of the framework to test it. And then, of course, we had external peer reviews. And this is how we more or less developed the CICI framework. So I'm quickly going over those slides now. I'm also going over those because this is describing what a concept analysis is in detail, and I don't think it's too relevant for us. So just gonna jump quickly to the result of this context analysis, but you have it in your slides if you want to go back into it. So after looking into many definitions of context, we were able to distill out that context is a set of characteristics and circumstances consisting of active and unique factors that surround an implementation effort. It influences, modifies, facilitates, or constrains an intervention and an implementation effort. It embraces roles, interactions, and relationships. And in contrast to the setting, you can put a boundary between context and setting. That's what we found in the literature. So we saw that setting refers to a much more physical and specific location in which an intervention is put into practice. Implementation, we were able to define as a planned and deliberately initiated effort with the intention to bring an intervention into practice. These efforts are undertaken by implementation agents, which are either actively promoting the intervention or adopting it. These efforts are usually structured into an implementation process that comprises different steps. And in these steps, you're rolling out different implementation strategies. And I think that's a field that has received a lot of attention over the past years. Implementation strategy is one of the things which evolved quite a bit, I would say. Implementation can and is measured in terms of specific implementation outcomes, such as adoption, uptake, or sustainability. And of course, we acknowledge that both concepts are highly intertwined and interacting. So what we found during this concept analysis, and I think that makes our framework a bit special, that we actually dive deeply into what people meant when they talk about context. For implementation, we found that the definitions largely overlap and they're talking about the same things. It has relatively well-defined boundaries. So it was quite a mature concept compared to context, where definitions vary widely. There are blurring boundaries to neighboring concepts, such as setting and environment. And a lot of aspects of context are very ill-defined. We also then, well, now I'm going to jump that because it takes a while to explain what we did here, but we also did some kind of a critical appraisal of frameworks we included in the development of the CICI framework. And if you're interested, you know, I'm an old systematic reviewer, so we like critical appraisal tools. We developed our own when looking into other frameworks, and that's the outcome of that. If you're interested in method stuff, this is a slide to remember. But I would like to move into the CICI framework. So I think you all are familiar with the difference between frameworks, models, and theories, Carlos, right? So we can jump. We can also skip that slide. I always like to put it up because sometimes we're not on the same page when it comes to that. But with the CICI framework, we're definitely in the framework side of things, right? So we're not in a model and we're not in a theory. This is how the final CICI framework looked like, but I would like to go into like what the CICI framework is composed of. So first of all, we have an intervention that is put into practice, right? And oftentimes we in public health talk about intervention packages. That's also why we put a package here, because usually it's not one thing, it's a lot of things, and it happens on various levels. This is a way of how you can describe an intervention, and this is very much based on logic model kind of thinking. So when you describe interventions, you sometimes use logic models or theories of change or program theories to describe the intervention. This is how we described an intervention within the CICI framework, but this is actually something you can do very differently depending on the type of intervention you can look into. So this is just one way to look into intervention theory, design, and delivery. And then, of course, we had context. And what we came up with after analyzing existing theories, models, and frameworks were that we should look into those domains, which are geographical context, epidemiological context, the social cultural context, the social economic context, the ethical context, the legal context, and the political context. And we actually came up with definitions for all of those. And while developing those definitions, we worked with experts in those fields to come up with a definition that was applicable to those aspects of public health interventions. So this was done in a very participatory way. And then we would have the implementation aspect of the CICI framework. So you would have an implementation theory that would guide an implementation effort. You would have implementation agents that are actively delivering an intervention. You would have the implementation process that comprise certain steps. You would have implementation strategies that are rolled out to implement an intervention. And you would have implementation outcomes by which you can assess the success of an implementation effort. Also, for all of those, we provided specific definitions. And as I show them to you on the slides, I think that's one of the reasons why the CICI framework gets cited quite a bit, because we were very thorough about developing definitions, working definitions for all of these aspects. And I think when you look at, for example, teams that work in developing, implementing, and evaluating complex interventions, you would always have expertise for certain aspects of implementation or context. So you would have sometimes people that are working in the health economics field, right? But you rarely have people that work in the legal field or in the political field. So we just wanted to make sure that people that work in public health have something they can start to work with by providing very concise definitions. So this was one of the specific things we had in mind when developing the CICI framework, and I think it's a reason why it's getting cited so much, because we're very concise when it comes to providing definitions. And in research, we do love definitions, don't we? So let me see. In the middle, when you have context and implementation and an intervention, all of that comes into play in the middle of this framework, in the setting. And we separated it from the context by saying this is the very specific physical location in which an intervention is put into practice. Here, things come into play. So this is where the intervention, the context, and the implementation interact, and they interact in such a way that an intervention shows effects or it doesn't, right? And this happens also in a dynamic way, so it changes over time, right? So if we look, for example, at different interventions in the settings, so you would have something like home-based palliative care, where the setting is the home of a person that is receiving palliative care. And it does not only embrace the person receiving palliative care, but maybe also the relatives or the informal caretakers of that person. If we look into introduction of injection needles with safety device in a hospital, that is a very different setting, isn't it? It's happening on maybe a hospital basis. And I bring you another example, the Bavarian smoking ban that abolished smoking in indoor facilities, and people were super angry that they were not allowed to smoke in Bavarian beer tents anymore. It was a big discussion happening in Bavaria because people love their beer tents and they also like to smoke in those. And if you look at interactive video conferencing to provide psychiatric services, or the introduction of improved sanitation in the community in the Philippines, where I did my master thesis on, or the Clean Air Act. The question is, what is the setting for all of those? You can see that there's a lot of things happening, not only on the very like home level, for example, or the very like a very small situation, but it happens often on a multiple layers. It doesn't only happen in this specific physical location, but it happens on many, many, many different levels. So sometimes it's 5, sometimes it's 1, sometimes it's 2, but it's happening most of the time for complex interventions on various layers. And we kind of reflected on that in the CICI framework by introducing the different levels, which was very much borrowed from the sociological, I think that's the correct term, sociology, from the sociological field of research, where people talk about the layers in terms of micro, meso, and macro level. And we attended to that and integrated that in the CICI framework to attend to that very fact that sometimes it's very hard to disentangle the different layers on which an intervention is implemented. So the macro level refers to everything surrounding a community or an organization. It can include the regional, national, or international environment. Then you have the meso level, which can refer to both the community and the organization. So we specifically attended to the community rather than focusing on organizations only. And then the micro level refers to the level of direct action where things come into play. So we kind of implemented those different layers to attend for the complexity of public health interventions. On top, and that was interesting enough, a feedback we received from peer reviewers that something was missing from this way of conceptualizing complex interventions. And he was referring to a case where he said, well, you know, we did things in a way we thought it would make so much sense, but at the same time, the Bill and Melinda Gates Foundation did something else and they had much more money, and that changed everything in the way we implemented this intervention. So what we added based on this feedback received from a peer reviewer, we said that, of course, there's also something happening like other independent interventions that might change the mindset, that, you know, might roll out huge marketing campaign and people do have a different attitude towards an intervention or towards a different, to a different behavior, right? So things can happen. And I think that attends very much to the dynamic nature of context that is in place, right? So this is the CICI framework as a whole. It's very, so I say now it's very complex, but actually one of the criticisms I receive a lot about the CICI framework, and I do receive a lot of criticism and I always like to hear it because I can learn from it, right? One of the criticisms I liked the most was actually, you know, Lisa, you're talking about complexity and complex. But now when I look at this, it looks very simple and it looks very tidy. Where's the fuzzy boundary in this? And where's the kind of the overwhelmingness of complexity in those types of things? I think it's a fair point, but when you come up with graphical displays for frameworks or theories or models, you always have to, I think maybe one of you has a better solution to this, but I always feel like we have to simplify in order to make things communicable or to facilitate communication about something. Because if I had fuzzy boundaries around all of this, and if there was there is some kind of linearity, of course, because it's a two-dimensional framework, right? So it never does justice to the real complexity, and I'm aware of that. And if you have any solution to that, please send me an email and we can work towards CC 2.0. When publishing the CICI framework, which was already almost 10 years ago, it's a very long time ago, we also came up with a couple of tools that people are still using, and they sometimes send me feedback on it. So also here again, if you use the CICI framework and you make experience with it, good or bad, shoot me an email and I'm happy to hear about it. So we're moving towards the hopefully more interesting part where we get to talk about things. So the CICI framework, what it does, hopefully to facilitate a structured and comprehensive conceptualization, assessment, and reporting of context and implementation. It can be applied and is applied in all types of research. It can be applied, for example, as a determinant framework where it's applied more or less like Cypher, where you have the certain dimensions and domains and you just work on them and more or less list them and describe them potentially. This is a way of how you could apply it. You could also use it as an evaluation framework, although this is less the case for the CICI framework. It can be applied in mixed methods, qualitative and quantitative reviews. It is also used in guidance. I'm going to show you a slide on that later. and it's applicable for researchers and decision makers. And one of the reasons, at least that's the feedback that I received, was that we do have a graphical display. So people seem to like the graphical display, although it's very simplistic. Yeah, I think what is the added value of this, or what are some of the added values of the CICI frameworks? It makes assumptions explicit. It provides those definitions. I think people appreciate it for that. It's embedded in a broader public health perspective rather than a very narrow organizational, clinical perspective. And it very much attends to like multiple disciplines, that it integrates not only based on the literature we looked into to develop the CICI framework, but also in the disciplines that we kind of had on board when coming up with the definitions, for example. Yeah, it does have, of course, its strengths and limitations. So, of course, we had a limited literature review. You can always go broader and bigger, and we had to put some limits to it, right? So there's always the scope of literature. We are very much aware that the setting dimension is less conceptualized compared to context and implementation. We didn't use any formal method of consensus building. Yeah, and well, I think the CICI framework to the full extent is not been tested yet. I'm going through the citations of the CICI framework. I'm going to show you about, maybe I'll bring it up later. Yeah, I said the CICI framework is used in a couple of guidances. Sometimes I don't know how people found it, and sometimes I was part of them. One of the things I would like to stress here is also the translation of the CICI framework to other languages. Carlos, you were leading on the translation to Portuguese, which also gave me a gentle nudge to pursue the same effort in German. And I hope to get some funding for that. I think it would be nice to have that available in German too, since it was at least one German, a couple of Germans that were part of the team developing it. And I would like to share with you like what I would like to do next with the CICI framework, because as I said, the CICI framework is old. It's really, really old. 10 years in science is like, yeah, it's medieval, you could say. So what should we do next? So those are just thoughts, and some of them I've already kind of worked on, and some of them are already happening, and some of them are just something in the back of my messy mind. So I would like to move the CICI framework from a framework to a theory, which doesn't happen overnight, of course, but I would like to continue to mature the CICI framework in a sense that I would like to see what can we learn from previous applications in terms of mechanisms, in terms of pathways, and integrate that in the CICI framework. So I would like to do that. What I would also like to do is to operationalize the CICI framework in context analysis and monitoring. So how can we attend to the dynamic nature of context by implementing thorough mechanisms for context monitoring, also in a sense that we can make continuous adaptations to interventions as we roll them out. And not only the intervention, but also, of course, the implementation strategies, which are also subject to the context in which they are rolled out, right? Measurement, I don't know if you know Michel Wensing. He's one of the key people in Germany in implementation science. And I had a call with him recently. And one of the things he still thinks we need so much more work in and on are indicators and toolkits to assess context in a thorough way. And we all are aware, of course, that you can't assess context as a whole because it's everything, right? How do you assess everything? You can't do that, mostly to resources and time. So we do have to prioritize. And I think we do have to find a good way of how to do this. And this is actually something that we're working on right now, to develop approaches to context analysis and monitoring. And that kind of aligns with the measurement aspect. Yeah, usability and accessibility. We don't have a website. So I think we are missing a website, and I think we should have one for the CICI framework. But also I think that is a question of resources. So I do need some funding to build those websites, and I might get one. Who knows? Yeah, and then I would like to, and I said that before, I'm working towards synthesizing the use of the CICI framework. So I would like to look more, and I already started that, but in more an informal and very unstructured and non-systematic way. So basically the way you shouldn't do it, to look into how have people applied the CICI framework until now. What did they like about it? What did they not like about it? What was missing? What did they add? Because I think this is really the beauty of applying a theory, right? You use it and then you see it doesn't fit and then you extend it and you make something out of it which hasn't been there. So you just create a new thing, and I would really like to see what people make out of the CICI framework. So this is what I would like to move into next. Just a few ideas. And with that, I'm at the end of my presentation, and I'm really glad I made it much faster than I expected to, because I cut out a couple of slides. So now we do have 13 minutes for discussion. Thank you so much for your attention. It was a lot, I'm aware of that, but I'm very much looking forward to discuss with you the CICI framework, context, implementation science in general. Please speak up and shoot me your questions. It doesn't have to be a question to me, but we can just discuss about whatever comes to your mind. Thank you.
Brilliant, brilliant. Thank you so much. So many notes that I took here, and I would just say that I have a lot of material to discuss with my research group, and I am so happy for that. And just to start the conversation, I would like to remark some things that really pops up to me. First of all, it's like, actually, I'm really impressed. I didn't know the analogy with the toothbrush. I love that. It's wonderful, and it kind of aligns with the first point that I would like to raise here. That, you know, here in Brazil, these discussions around implementation science are really strong right now, but it just started like some years ago. So we are just like getting to know all the frameworks, or all the theories, how to work around implementation, trying to understand the differences between implementation and the intervention itself. That's always a confusion, and we're so glad that we can hear that someone with this extent of experience and faces the same barriers. We feel like more like, oh, okay, we are on the right track, right?
Yeah,
and
if that's what makes an implementation scientist, then you are.
Okay. So one of the things that it always comes to my mind is that we are using a lot the CFIR, the Cipher. That one of the, actually, I just aware of two large frameworks that have been adapted to Brazilian context. That would be the Cipher and also the TDF.
Yeah.
And I see them being used a lot. And I use them a lot. And I had this feeling that we are always struggling to trying to, put things together, like categorize things within the Cipher, especially when it comes to understand, is it like an inner setting? Is it an outer setting? But this definition of culture, that doesn't align well to us, it seems. And you say something that is very important to consider, that it came from a base of organizational theory that is very different when you put that to interact with public health interventions and the problems that we have to do within this field. And one thing that it made me remind, and I'm so sorry that Professor Hosanna couldn't be here today, because actually Hosanna was the one that found CICI Framework and presented to us. And something that she always starts talking when she is giving a lecture about implementation science is like remind the foundation of our country. And the first time that I heard that, I was like really intrigued where Hosanna is intended to go when she's recovering the story and talking about how Brazil was like, had like centuries of slavery, these racial differences and impacts that we have till now in our health services when we are dealing with racism and gender issues and everything. And I was like so curious, well, she's talking about implementation science, why she's recovering that? And then I understood when she was like, okay, so when you have a context like that, you cannot expect that everything will come together in a box. And with one simple, really strict framework, we will be able to match everything, because that are these fuzzy boundaries, as you said. And so for that, I would like to say that it makes so much sense, like the story that you're telling to us, and how the CICI framework seems to be a light for us in working around those things. And we are really excited in being adapting this framework to apply in our context and see what answers it can give to us that we are not finding in what we have already, like adapt to our reality. And so, yeah, just to introduce like where we are and how that resonate to us, like in the same way, So thank you for that. But just sharing those thoughts and to warm up the discussion, and I will just give some time for people to like raise their hands. I don't see the line for raising hands, but I will make sure of look to the chat. So if anyone have a question, pop up in the chat, and if you would like just to say out loud, just put in the chat and I will call you, okay? And I have already a question here from Wilson that is considering that context is dynamic and that interventions are elements of the system dynamic, can't we also consider that the own researcher and the fact that they are studying the context with the goal of planning interventions as elements in themselves of the context dynamic? Great thought.
So you mean that the researcher herself or himself is also part of the context, and that needs to be reflected. Did I understand that correctly? I don't know why I can't open the chat.
Oh, okay. So sorry for that.
No. You're. I think now I'm back in the chat. I can read the question. Considering. Yeah, I think this is super important because I mean this attends much more to the principles of qualitative research, because you are yourself always the instrument, right, in research. So of course you do have your own perceptions and perspectives towards how you conceptualize things. And I think the very fact that we have multiple frameworks in implementation science reflects exactly that we are looking at the world in a different way, right? And each researcher looks at the world in a different way. And the way we then try to explain the world when reporting on our research findings, right, it reflects how we see the world, right? And it reflects our own history, where we grew up, like how we are embedded into that system, right? So I think it plays a very big role. And I think there's now increasing tendency to look into like the reflection section of a paper, right? Where you would say like, this is how we look into things and this is how we perceive certain things. And then you can always kind of, I think you should very openly disclaim that in papers, but also through stakeholder engagement, you can make sure that it's not only your perspective into things that comes into play, but maybe also other perspectives. So you attend to all of your own researcher context, more or less, and report on that transparently. Because I mean, that's sometimes all you can do is be transparent about the things you experience, about how you perceive them. And then that's the basis for then reporting on it, and then maybe people learn from it and you can transfer that to different settings and contexts. I'm not sure if it answered the question correctly, but that's how I read it.
Brilliant. Please, if you have more questions, just write in the chat, and I will take the moment just to share another thing that particularly for me, it's really interesting because it resonates with my practice in the last years, that I would like to know how, a little bit more about how did you guys get into these different levels, the micro, meso, and micro level of all of that are being considered in the framework? Because something that we learned from practice in the last years were the difference to the importance of mapping stakeholders in these different levels, and how in our experience to bet on the meso level get more results to us in engagement and in commitment than invest, for example, in macro level, in macro, managers or things like that. So I would like to just hear a little bit more about that, please.
Yeah, I mean, again, fuzzy boundaries, right? So where's the boundary to macro level? Sometimes it's easy if you say you have a regional government, for example, regional decision makers, and then you have national decision makers. And I usually would say that actually in the micro level, you would easily identify and get the stakeholders on board to support you with your research, right? And I think it gets more difficult the more upper you go. But it also depends very much on the type of stakeholder you're looking at, because if you look at decision makers, I think that's very difficult. But if you, for example, look into people that are champions of change, so people that influence others with their opinion, or like they share openly, or I don't know, lobbyism, right? I think these people sometimes are much more open towards becoming engaged with implementation efforts and interventions. Actually, I worked in a Cochrane review on environmental interventions to reduce the consumption of sugar-sweetened beverages. Super long name. And we wanted to create a stakeholder advisory board on that. And we immediately received positive responses from industry. We were then not allowed to have that stakeholder advisory panel because of conflicts of interest. So Cochrane really was very strict on that. We couldn't have the stakeholder advisory board. But I found it was very interesting that we were able to get very influential and very high-level people in the lobbyism industry field to be part of such an effort. So they seem to be very interested in being engaged in that. Maybe that is the conflict of interest right there, right? Compared to decision makers, which were really more hesitant to become engaged with us researchers, because Cochrane reviews, of course, are super lengthy. So I think we worked on that review for 3 or 4 years. It was super long. And I worked on another Cochrane review for 6 years. So I can understand why people are hesitant to work on those. But yeah, I think it depends on maybe the topic and the interests people have in contributing to that.
Brilliant. Thank you. Thank you so much. While we don't have questions in the chat, I will take the opportunity because I have like a lot of notes here. So another thing that caught my attention was this this need or this difference that you guys made like important to mark this difference between context and setting. And that's something that I've been struggling with in the past years. So how did you guys get into conceptualize this difference?
So I think the boundary that most people in the literature draw is that setting-based prevention or setting-based health promotion. And this was something that a lot of people in our working team used to work with. So for us, actually drawing that boundary was then again very much embedded in our experiences in working in public health, that we say, well, we have these settings, right? So very concrete settings where we would put a water dispenser into place, right? So people had, I think we had such a clear picture in mind from the way we did public health as like working in public health, right? So I think for us, drawing that boundary was rather simple compared to the boundary that was drawn in literature. So again, here, we as researchers came into play and kind of pushed, or I mean, in the end, we were able to find similar notions in literature, which then supported the way we conceptualized the boundary between setting and context. But yeah, thinking back and having spoken about this, you know, being the instrument, I'm wondering whether a lot of this is actually very much based in our experience as public health researchers, having worked in that field for a couple of years. So it might be that. And I'm super sorry, Carlos, but I'm already receiving emails from my colleagues that are starting the workshop that I have to join the other meeting. I'm very, very sorry for that. And I would have loved to exchange on this. However, I'm very, very interested in keeping this exchange going via email or whatever. Please add me on LinkedIn if you're on LinkedIn. Be happy to build the network and reach out if you have any questions in the aftermath. I know it was super intense and it was a lot, but I tried to compress as much as I could in the hour preparing then for the meeting again. So yeah, I'm very sorry that I have to leave now, but I do need to be in Johannesburg.
Please don't be. Thank you. We are so grateful for your time with us, for your presentation. It was dense, but it was dense because it was so brilliant and so profound and so like thought-provoking. It was great to hear you. Thank you for your collaboration, for your availability. We are really grateful for that, and we clearly understand we had like this this time difference that changed during our conversation, and I didn't anticipate that. But thank you for this time with us. No, it's okay. Thank you so much.
Thank you so much. It was so nice to meet you, and I hope you have all a great week and a great rest of your day. And hope to see you all somewhere soon. Implementation Science World is a small world, so it's not unlikely that we run into each other somewhere.
That's right. Thank you.
Bye. Have a nice week. Bye, and a nice day.
Bem, olá pessoal, então, justificando, né, a gente teria mais uma meia horinha programada, mas, e aí eu vou assumir a responsabilidade, eu não me atentei para uma mudança de fuso horário que aconteceu na Alemanha no último mês. Então, as minhas conversas com ela acabaram ficando considerando o horário anterior, de quando a gente começou a conversação, e quando a gente fechou, né, o nosso seminário, o horário tinha mudado. Então, hoje, de manhã cedinho, 8 horas, ela me mandou mensagem, olha, eu estou no link. Então, a gente teve essa 1 hora de diferença aí, por isso o nosso seminário acabou sendo um pouquinho encurtado, tá bem? Mas, como vocês puderam ver, a professora Lisa é uma pessoa extremamente acessível, ela deixou o contato dela aqui para a gente, né? Eu vou colocar, inclusive, mais uma vez no chat, então, fiquem muito à vontade para mandar um e-mail para ela, e também, né, se quiserem nos contatar, fiquem muito à vontade, que a gente vai ficar muito feliz em fazer essa ponte. Como foi mencionado anteriormente, então, a gente está muito feliz em estar trabalhando na tradução e adaptação desse framework para o nosso contexto brasileiro. A gente já está na fase de fazer um encaminhamento agora, né, para avaliação de especialistas e do público-alvo. Então, a gente está num trabalho bem avançado, espera aí que, quem sabe para o próximo ano, né, contando todos os nossos tempos de revisão, publicação, a gente já tenha disponível essa ferramenta para auxiliar todos vocês que tiverem interesse, né, em ver o quanto ela faz sentido para aplicação nas práticas de pesquisas aí de vocês. Eu queria agradecer muito a presença de todos vocês, dizer que para a gente é uma alegria muito grande promover esse seminário como um aquecimento para o nosso evento de setembro. Espero que vejam muito de vocês, possa ver muitos de vocês no nosso evento, onde a gente vai conseguir discutir uma série de outras questões aí importantes em relação ao campo da ciência de implementação, tá bem? Agradeço vocês, vou fechando aqui o nosso seminário, mas vou deixar a sala mais um pouquinho de tempo aberta para eu conseguir colocar todos os links aqui no nosso chat, vocês terem acesso a eles, tá bem? Muitíssimo obrigado e um ótimo dia, ótima semana para vocês.